Thank you for joining me for Population at Risk. My name is Jessica Copley. I'm an LPN to BSN nursing student at Indiana State University. Today we're going to be talking about a population at risk, including those with depression. Objectives include those who observe this presentation will understand the difference between different types of depression, understand who is affected by depression, be able to recognize risk factors of depression, be able to recognize symptoms in ourselves and others with depression, understand types of treatment plans which work best, implement practices to reduce depression, and know where to go for help. At this point, please pause this presentation, take the pretest, and join back when you're ready. Types of depression include persistent depressive disorder or dysthymia. This is a depressed mood that lasts for at least 2 years. They may have episodes of major depression alongside periods with less severe symptoms. There's psychotic depression, which has severe depression alongside some form of psychosis. There's usually a depressive theme, such as delusions of guilt, poverty, or illness. Bipolar disorder can also have a type of depression because they have very low lows and high highs, which are manic. Other forms of depression are seasonal affective disorder, which is only during the winter months. Those individuals tend to withdraw, increase sleep, and have weight gain during the winter months, and it tends to return every year. There's also postpartum depression, which is not just the baby blues. It is a full-blown major depression during pregnancy or after delivery. The feeling of extreme sadness, anxiety, and exhaustion becomes overwhelming, and they are not able to care for themselves or their children successfully. Statistics for depression is it's most frequently diagnosed in the U.S. It is the most disabling mental illness. It affects 18.8 million adults, 9.5 18 and older. Children in preschool are 0.9%, school-aged 1.9%, and 4.7% adolescents, and this is solely off of those diagnosed. 4% have never been diagnosed between the ages of 3 and 17, with teens being upward of 12%. This often co-occurs with heart attack, stroke, diabetes, and cancer. 25% of women suffer from depression and 12% of men. There are many people suffering, but about only 2/3 of those people ask for help. Risk factors include family or personal history, suicide attempt, verbal or physical abuse, sexual abuse, substance abuse, chronic medical condition, loss of a loved one. It can also be with attention deficit or hyperactivity disorders. Common symptoms include persistent of sad, anxious, or empty feelings, feeling hopeless or pessimistic, feeling guilt, worthlessness, or helpless, a low interest in activities, low libido, fatigue and decreased energy, difficulty concentrating and making decisions. They can have insomnia, wake up early, or excessive sleep. Thoughts or attempts of suicide are common. They can overeat or have appetite loss. Another symptom is aches or pains, headaches, cramps, digestive problems that are not alleviated without treatment. If someone is suffering from depression, there are many treatments available. There are pharmacological therapy. These include antidepressants to reduce the symptoms. There are many different types, so it's important to find one that works best for you. It does take a while to work, about 2 to 4 weeks, so it's not expected to work immediately. It needs to be fine-tuned. Do not stop taking these without supervision because they can have thoughts of suicide. Teens and early 20s need to be well monitored as they begin taking antidepressants because they can have increased thoughts of suicide and self-harm. Another treatment option is psychotherapy. With a therapist, they go through behavioral changes, interpersonal therapy, and problem-solving therapy to reduce depression and be able to manage life a little bit easier. Another treatment option is electroconvulsive therapy. It is a series of sessions, typically 3 times a week for 2 to 4 weeks. Side effects include confusion, disorientation, and memory loss. ECT is not painful and cannot be felt, but it can help with acute depression where everything else does not help. It can also be a first line for depression. Goals are to obviously find a method that works for you. Commonly, the best options are both antidepressants and therapy, but also including exercise, setting realistic goals, being able to confide in a trustworthy friend so you have support. Do not isolate yourself. Seek out help. And do not expect things to change immediately. It does take time. And it's important that important decisions are not done in a depressive state, but rather wait until you're feeling better. And like always, please ask for help and support. There are a lot of people suffering from depression. For healthcare facilities, it's important to take an assessment for everybody, including the CSD for the depression scale. If you are feeling depressed or having suicidal thoughts, please seek help. There are many depression hotlines, including 800-273-8255 for National Suicide Prevention Hotline, SAMHSA 800-662-4357, or Samaritans 877-870-4673. For more information, please visit NIMH. It's a great resource to learn about depression and how to help those who are experiencing depression. Also, you can go ahead and take the quiz, the assessment at American Psychological Association, and that is a good starting point to see if you're suffering from depression, and then you could seek help. Please, at this point, take the post-test. You're welcome to print out the outline, and please share this information and ask for help if you need it. Thank you.